Hi, I'm Miriam Evans, one of the pelvic health physios working in Powys. My colleague is Linda Van Dorn and she covers the north of Powys and I cover the south. This is a video created to talk to you about pelvic girdle pain, which you may have heard of as SPD or pubic symphysis disorder. You might feel like you've got sciatica, whatever you name it, pain in your pubic bone, pain in your sacroiliac joints, which is the dimples in your back, your lower back. It might be that you've got pain in your hips or down the front of your thighs, or radiating up into your vagina. Generalized anywhere pain in your pelvis, whether it's on both sides or one-sided. Pain can be caused from different reasons, but generally in pregnancy it's due to the laxening of the ligaments from the hormone relaxin as the pregnancy develops. The ligaments get more relaxed, which means there's more movement in the pelvis, and as well as that, your muscles are stretching as the baby grows, so you've got less stability. So I'll just show you my pelvis, and you'll see that you've got the pubic bone at the front. You've got a ligament holding the two parts of the pelvis together. So there is a potential for movement here, and you'll see the width of the pubic symphysis here. It actually expands twice or three times the size during a pregnancy. So there's a lot more movement that can happen. And if you look back here, this is your sacroiliac joint. It's quite a large flat joint. And if your pelvis is lovely and stable and your muscles are nice and strong, then very little movement will happen at that joint. But I'm just going to show you what happens when we get more movement. If you have a look at the gaps there, there's a lot more movement going on. So you get a bit of aggravation and inflammation if there's a lot of excess movement. And if there's excess movement here and here, you'll find that there's going to be excess movement at the front as well. So you might find that you get pain just at the front or just at the back or in both places. And it might be that you're getting pain down in your coccyx area here, and it all depends on how the muscles are working and whether your muscles are compensating. So not only do you get weak muscles as the core muscles start to stretch, as your tummy muscles stretch, but actually you get overactive muscles where other muscles are trying to compensate to stabilize your pelvis. So it might be that you get achy, tight muscles in your back as your tummy muscles start to get weak, or you notice the side of your legs down to your knees get tight as your glutes start getting weaker. So pain could be in any position, any place in your pelvis. But generally what we are going to look at doing to help with that pain is to keep you moving, to strengthen your muscles and to think about your posture. So try and listen to your body, choose your battles. So if you're thinking you want to get active and you want to keep active, then choose your timings when you do that. If you've had an exhausting day at work, don't try and come home and do a lot of exercise. It might be that you come home and do some gentle Pilates or yoga stretches. If you've been sat in the same position all day at work, it might be that you want to do a bit of gentle walking to keep moving. So you've got to listen to your body, and if your body's exhausted, then don't do it, or have a day off and do some more on another day when you've got more energy. Again, choose which tasks you do. There's lots of things that you can do being active, but some of those put more stress on the pelvis. For example, if there's a lot of bending in that activity, or heavy lifting or twisting. And then if you combine all three of those, for example, doing the hoovering, then you're going to notice that that's going to aggravate your pelvis and possibly trigger it for a few days before it settles. So try and choose your battles, accept help when you can. If you can avoid shopping, for example, and order online, or if you are going shopping, just be aware that of the trolley and trying to steer the trolley, trying to push it round rather than trying to pull it round using your stomach muscles. And even when you get home and you've got your car full of shopping bags, just taking one or two bags at a time, or letting your partner unload the car, just choosing your battles. It might be that you unloading that car rather than waiting half an hour for your partner to come home means that you're in pain for the next couple of days, whereas actually you could have avoided that by reducing what you did then. Staying active is really important, but it's also you'll find that any position you stay in longer than 10 minutes starts to hurt. So it's pottering around, doing little and often. Try not to sit for longer than 10 minutes. Don't stand for longer than 10 minutes. And walking, you might find that just walking 10 minutes is enough. And if you walk for more than that, then you start to, with that constant moving of the pelvis that I showed you on the model, that you're actually starting to cause more pain and inflammation that takes a while to settle. If you can think about good posture in everything that you do, you're going to reduce the amount that pelvis moves. So if those muscles are engaging because you've got a good posture, then there'll be less movement as you walk, less movement as you're doing your housework. So please watch my antenatal video before you watch this, because there's a lot of advice on that will help your pelvic pain. Doing your pelvic floor exercises, doing some gentle core exercises of those lower abdominal muscles, just drawing them in regularly when you're sitting down, and the pelvic tilting I've gone through on that video as well, just to that you can do in any position to stretch out your back muscles, activate your abdominal muscles. And pelvic tilting you can do when you're sat at work. If you're sat for a long time, you can do it when you're sat at home on the sofa. As soon as you start feeling a little bit of ache or stiffness, start tilting your pelvis back and forward. You can see I'm doing it now. You can do it in bed when you're lying down, you're starting to ache after sleeping a couple of hours, and you just turn over, do some pelvic tilting, then turn over and do some pelvic tilting before you go back to sleep. Try and find good resting positions that offload the pelvis while they support the pelvis. So if you come home from work and you're exhausted and you need to rest, you might find slumping on a sofa actually isn't the best of positions for supporting your pelvis. You might want to go upstairs to your room and rest on the bed on your side with a long pillow between your legs, or buying a maternity pillow. You might want to make sure your pillows go not just between your knees but between your ankles. I like to have a little pillow, that's a much smaller pillow, but under my waist. So depending on how big your hips are, it might just avoid the twist of your pelvis when you're lying down. So check your positioning. A little tip for rolling over in bed is try and log roll. So don't twist your knees then your shoulders. Try and roll as one. But to make your bed more slippery, you can order some lining material, or if you've got a shop nearby that sells a material shop that sells lining material, get a couple of meters, lie it on top of your sheet, and it just slides with you. So as you go to roll, it reduces friction, so that can make a big difference for turning over in bed. You can also put a piece on your car seat, or a plastic carrier bag on your car seat for getting in and out of the car, because again, it's a twisting position that can aggravate. So think about, going back to your resting positions, another position, if you want to just be on your belly, it might be that you've got a big duvet, gather it all up in a big pile on your bed and just slumping over it so that your bump can nestle into that duvet and it feels supported, and that can be a lovely position. If you're feeling really stiff, just doing some gentle exercises, some gentle Pilates exercises. I've created an antenatal exercise video that you can have a watch, that's on this channel, and it should be okay for you to do. If any of the exercises hurt particularly, then just avoid those exercises and go on to the next one. So as I talked about in the antenatal video about posture, just be aware of maintaining an equal weight bearing on each foot. So don't try and don't try and slump so that you're just standing on your right leg with not much weight on your left. Try and stand evenly with your pelvis in an even position. Imagine your pelvis like a bucket of water, and you don't want to spill any of that water out forwards, backwards, side to side. So when you're walking, you might find it easier to take smaller steps so that you're not twisting the pelvis so much that pelvis imaginary bucket can stay more upright. Going up and down the stairs, if you do one step at a time, again, there's a lot less twisting. So it's a lot of the time with pelvic pain, it's an accumulation throughout the day. So you might feel fine in the day and you're doing all these different jobs, and by the evening it hits you. But actually, if you can think about what you're doing in the day that might impact later, you might get a lot less pain later on in the evening. So thinking about exercise, you don't have to do high impact exercise. You could be doing gentle Pilates, yoga exercises. Think about short walks, but thinking about with your posture in a good position when you're walking. If you've got a pool nearby that you can utilise, just being in the pool takes the weight off the baby off your pelvis. And you can do some gentle aquarobic type exercises, or you can just float in the water for 10-15 minutes. Even just walking widths in the shallow end back and forward, so that you're able to do some walking with the weight off the pelvis can be quite nice and a relief. Some other little tips. If you are someone that likes to wear high heels, you'll find that it pushes your pelvis forward as though you're tipping that water out of the front of the bucket. And that can put your pelvis into a really unstable position. So you might want to consider reducing the heels on your shoes. You probably find that going flat, having no heels at all actually be also quite painful if you're used to high heels. So try going for some kitten heels. Otherwise, think about really supportive shoes. So if you're having to like flip-flops, you have to curl your toes to keep them on, or if you're wearing wellies a lot and they're a bit baggy on your feet and you're curling your toes a lot to stabilize, to keep them on, then you're probably going to be overworking your calf muscles, and that will work all the way up towards the pelvis. So try and find shoes that fit well, potentially lace-ups that you can tie up, and shoes that have good arch supports, particularly if you've got flat feet. If you can get your feet in a good position, it helps with the pelvis being in a good position as well. Think about pain relief techniques. So a hot pack can be quite nice if you've got a hot water bottle or a wheat bag. Obviously, make sure that you don't put it too hot because it will burn you and burn your skin. So you could use a hot pack or a hot water bottle behind your back, particularly when you're resting in the evening before you go to bed. Hot baths, some people love them because of the heat, and some people find that the position you're in when you're slumped in the bath, although it feels lovely while you're in the bath, actually it puts the pelvis in a bad position so that it hurts more when you get out of the bath. So that's going to depend on who you are and what you find helpful. Don't be scared to think about medication pain relief, but talk about that with your midwife or your GP. I know that you might be thinking, well, I just don't want to take any medication, but if that a little bit of some paracetamol or something stronger if needed helps you to sleep better, then actually your cortisol levels can come back down to a normal level, and actually that can help with your back pain. So if you can get on top of sleep for a couple of nights, then it might make the pain better overall, and then you won't have to take the pain relief long term. The other thought is TENS machines. You can use your TENS machine throughout your pregnancy safely. So that's something to consider. There's lots of research that says that it shouldn't cause any problems with causing early labour. If it creates any sign of contraction, you just stop using it. So a TENS machine can be really nice relief. And breathing exercises. So there's lots of research that connects good breathing techniques. If you did 10 minutes of breathing, deep breaths in and an even longer breath out than your in breath every day, then it helps to relieve stress, but it also reduces your cortisol levels, which reduces your connective tissue tightness. So some back pain can be caused because of a tension that's in your body, a connective tissue tension, and breathing exercises are a really great way of doing that. So if you've not looked into it already, have a look into your hypnobirthing, because it'll help with your birth, and you can be practicing 10 minutes of that each day, or more if you want to help release the tension in your body, which will help the pelvic pain. Belts can be useful, but they're not the cure. They're just standing in for your abdominal muscles. So the ideal thing is to strengthen your abdominal muscles. So if you can start doing some simple core exercises, you can do my antenatal video. Even as I said, just bracing your tummy regularly throughout the day, your lower abdominal muscles, not your upper abdominals. You want these to relax, and you want to activate those lower abdominals just inside your hip bones. So I think that's mainly most of the advice, but it's just keeping pottering about. Don't sit for too long, don't stand for too long. If you've got a desk job, just for every 10 minutes find a reason to stand up and move. And keep active. If your pain isn't resolving from watching this video and the antenatal advice video, then you can get a self-referral form off the Powers Teaching Health Board website under pelvic pain, or under musculoskeletal physiotherapy, you'll get just a general outpatients referral form. But if you mention that you're pregnant, it'll come to us as pelvic health physios. The other thing is there's some great advice on the pelvic obstetric gynecology physiotherapy website. So if you put POGP leaflets into Google, you'll have information about pelvic pain. You'll have information about pregnancy, exercise in pregnancy, recovery postnatal. There's lots of information on that website to help you. So if you're not improving with advice and with this video, then do get a referral to come and see us.